Hi guys, I am Preeti from Hassan Institute of Medical Science. In this video, I'll be teaching about the reversible cell injury, which is an important question for 5 marks, and it has been asked in the previous year. What is reversible cell injury and what are the changes during reversible cell injury, macroscopic changes, and what are the causes, gross appearance and organs involved, and microscopic features will be seeing in this video. That is during cell, a normal cell will be under homeostasis, means it will be under normal conditions, it will be maintaining a temperature, osmotic pressure, everything. Osmotically it will be balanced, everything it will be balanced. Whenever there is this appliance of stress may be injury, trauma, or else bacterial toxins, chemicals, anything will be in the form of stress, will be in the form of all this. The cell tries to adapt. Everyone will try to adapt. No, everyone wants to survive in this world. Everyone tries to adapt, and they want to make them better, and then they adapt. Adaptations may be in the form of hypertrophy, hyperplasia, atrophy, dysplasia. All this comes under adaptation. If adaptation is also it fails, it causes cell injury. Cell injury may be mild. It may be mild and transient phase, or it will be in a severe condition and it will be prolonged. If it is a mild and transient stage, it will be reversible cell injury, so that it can be reversed. Example, you take fatty liver. Alcoholic patients will be having a fatty liver. That fatty liver, if they stops consuming alcohol, that fatty liver is reversed and become normal liver. If in case that is prolonged, consumption of alcohol is prolonged, it becomes cirrhosis of liver, which is irreversible. So reversible cell injury, if it becomes reversible cell injury when it is the cell injury is a transient, and if it is mild. If that stress is removed under reversible condition, then again the cell becomes normal, the tissue become normal, organ become normal. If the stress is at a severe stress is applied and it is prolonged duration, it become irreversible cell injury. Irreversible cell injury causes cell death. Cell death may be in the types of two, it may be necrosis or apoptosis. We'll be seeing about the reversible cell injury in this video. Irreversible cell injury I'll be dealing in another video. Reversible cell injury. Any cell injury, the most common cause will be hypoxia. Hypoxia means decrease in tissue perfusion. That means oxygen, supplying oxygen to the tissue will be decreased. The most common cause for this hypoxia will be ischemia. Ischemia means loss of blood supply to the particular tissue. So there will be loss of blood supply. Blood will be having hemoglobin. Hemoglobin carries oxygen molecules. That is 4 molecules of oxygen is carried by hemoglobin, or 8 atoms of oxygen. So if there is loss of blood supply, oxygen supply to the tissue is decreased. These two are important questions for the MCQ point of view. And we'll see what are the changes during the reversible cell injury. Consider this as a cell. Cell will be having microvilli, and so cell has its sodium potassium ATPase. ATP, with the utilization of ATP, it pumps 3 sodium out and 2 potassium inside. If there is a depletion of ATP, because there is no loss of oxygen supply, so oxidative phosphorylation is not taking place, ATP will be depleted. So this pump fails to pump 3 sodium out. So sodium start accumulating inside. Secondary to sodium accumulation inside, water also enters in and starts swelling. Cell starts swelling. So this microvilli present on this cell will disappear and becomes a normal plain surface. This water started accumulating. Even still, if it progresses, it becomes blebs. This cytoplasmic blebs will be formed. This is projections of cytoplasmic outside. This is called cytoplasmic blebs. See, reason for the microvilli disappear, as I said, water enters in and then swells up. There will be disappearance of microvilli, and cells and cell organelles will be swelled. Cell organelles like mitochondria, endoplasmic reticulum, all will be swelling. Then cytoplasmic blebs, after the cell swelling, after disappearance of microvilli, there will be cytoplasmic blebs appearance. And myelin figures are formed. Why myelin figures are formed means these are the phospholipids which are present in the cell membrane of the mitochondria, or cell membrane of the normal cell membrane of the cell. This will be lost, and the components of phospholipids are myelin figures. Myelin figures you can see in both the reversible and irreversible cell injury, but these myelin figures will be present more in irreversible cell injury. Under light microscopy, what are the changes you can see means there are two types of changes. That is hydropic change, that is cell swelling because of entry of water inside the cell, and fatty change. With the example of a fatty liver, I'll be teaching in another video. Fatty change is also known as steatosis. the swelling because of a hydropic change and vacuolar degeneration. And what we call albuminosis degeneration is disturbance in protein metabolism. The term used for a disturbance in protein metabolism is called albuminosis degeneration. And we'll detailedly see how there will be depletion of ATP in the reversible cell injury. Whenever there is a ischemia, loss of blood supply, oxygen supply to that part also decreases, so there will be hypoxia. Mitochondria requires for oxidative respiration. Mitochondria requires oxygen. There is a decreased oxygen. Mitochondria start dysfunctioning. So oxidative phosphorylation also decreases. Oxidative phosphorylation was giving ATP. After oxidative phosphorylation, phosphorylation is production of ATP, so it was producing ATP. If this decreased, ATP production also decreased. ATP production decreased. Now three situations may happen. ATP is required for a sodium potassium ATPase pump. I told sodium will be pumped out, 3 sodium pumped out and 2 potassium will be pumped in inside the cell by utilizing 1 ATP. But this ATP is depleted, reduced. So sodium starts accumulating inside. Water retention will be there, so cell swelling will be there, so microvilli which are present on the cell membrane, this starts disappearing. And after the complete disappearance, still inside the inward movement of the water causes cytoplasmic blebs. These are the one condition. And other, because of loss of oxygen supply, there will be anaerobic respiration. Anaerobic, lack of oxygen, the respiration takes place under the lack of oxygen. It starts accumulating. The product of anaerobic respiration will be lactic acid plus carbon dioxide. Lactic acid starts accumulating. This condition is called lactic acidosis. pH will be decreased. Acidic pH 1 to 7, basic pH from 7 to 14. So less than 7 will be this pH is decreased, means acidosis. And then because of this pH decrease, nuclear chromatin will be that starts clumping. This is the other change we can see in a reversible cell injury. Other effects will be, rough endoplasmic reticulum. Rough endoplasmic reticulum is they have ribosomes attached to it. This will be, the function of this will be synthesis of proteins. If ribosomes get detached from the endoplasmic reticulum, there will be decrease in the synthesis of the protein. This is the other effect of the reversible cell injury. The first change, these are most important for MCQ question. The first change in the cell injury is a mitochondrial dysfunction. This is the first change. First morphological change. Morphological means which we can see. First morphological change is hydropic change, that is cell swelling is the first morphological change. And how grossly it appears. Here we'll see this reversible cell injury, how the gross features appears means the cell swellings will be there. All cells will form tissue forms organ. So the swelling of the cell also it implies that the swelling of the organ. So enlargement of the organ, it will be pale in color. Because of this enlargement, the blood vessels will be congested. So it will be pale in color. And cut surface will appear cloudy appearance you can see. And organs which are organs involved in a reversible cell injury means, I said liver, fatty liver, muscles, heart, kidney. These are the organs which are involved in a reversible cell injury. Microscopically, how you will see means, with the example I will say kidney tubules will take, kidney tubules starts accumulating fluid. That is water. It starts accumulating, then it ruptures. It starts accumulating, then it ruptures and the content will be released into the lumen. This is a condition where you can see the microscopically, you can see the ruptured cell membrane and the contents are released into the lumen. These are microscopic features. And this is also important MCQ question, that myelin figures are present in both reversible and irreversible cell injury. But in irreversible cell injury, the myelin figures will be more. I already told what are myelin figures. These are components of phospholipids which are formed by the breakdown of this cell membrane of mitochondria or the main cell membrane. This cell membrane is known, the phosphobilipid layer is there. Their breakdown of this releases phospholipids which get accumulated here. These are myelin figures. This is all about the reversible cell injury. You learned about the reversible cell injury changes, most common cause, and light microscopic changes, and what is albuminosis degeneration, and what are the consequences of this hypoxia or hypoxia. And then first change in a cell injury, gross changes, microscopic changes, and organs involved. All this you learned in this video. If you find this video helpful, please do like, share and subscribe to my channel. Thank you.